So in the advanced skin cancer surgery course, at the beginning of it, we tend to go over ellipses again and basic suturing, just to make sure that we've got a good foundation to build on, so that when we are teaching flaps and other various closure methods, we're not having to worry about poor technique or bad habits. And I find bad habits is what people tend to revert back to after coming to one of these courses. So it's good to just reinforce the proper technique with you. Then we talk about, in the advanced surgery course, we do talk about peripheral face and neck lesions. So applying the flaps such as rhomboids, Vita Ys, rotation flaps, and ear wedges. So anything to do with the peripheral face we will talk about, which then ends up with some case presentations. So all this stuff is done with pig parts, usually pig bellies, pig heads and pig legs, to replicate various parts of the human anatomy. We have several tutors that we do walk around the room while observing while you are doing these procedures, at least correcting your planning method and your techniques. The idea is that we spend a lot of time doing these procedures so that you can perfect them, at least on the pig belly, so that when you do come to trying these on your patients, we're happy that your technique is quite good and how it should be, and you're not making any mistakes on your patients. I'd rather you make all the mistakes on the pig belly and not on your patients.